Hello, how's it going? Today I'd like to introduce you to MCS, which is essentially a specialized swarm of agents to automate the entire healthcare industry. And our goal with MCS is to essentially build a decentralized network of autonomous agents that can uh, essentially provide diagnosis and treatment options to patients before they have to go into the traditional medical system, which has historically been very expensive and very inefficient as well. And so with MCS, essentially our goal is to build a fully autonomous swarm of agents that first solves medical coding. So medical coding is essentially taking a lab results of a diagnosis or even symptoms, and then coding that to essentially provide you with a code, and the code is essentially the for every disease in the world, there is a code for that disease, which helps doctors essentially detect what disease you have precisely. And if we go to the GitHub here, we could see how it works. So basically, you can run it in a couple of lines of code, less than 10. And basically, the architecture is you have a medical officer, a chief medical officer agent, you have a virologist, you have an internist, you have a medical coder, and finally, you have a synthesizer. And so these agents essentially take in symptoms or lab results or any type of input medical data. And then their job is to essentially convert that medical data into a code and also provide you a full-fledged diagnosis of what you have precisely, and also give you treatment options. So we have made this easy to use in our application here, MCS platform.swarms.world. It's free to use for the time being. And then we're going to integrate the MCS token as a payment option. So basically, the way that it works is here you say, I am, here you give it a task. So you say, I am having troubles sleeping. My head hurts, and I feel as if I have caffeine withdrawals. So you run it, and then the agents are all going to talk to each other and give us an output. And all the results will be saved. You could also upload a PDF if you wanted. And we also have an export option here. So you could export the entire conversation. And we have a couple of links here. We have our Twitter, Telegram, Discord. We have links to share it. We'll have the ambassador program soon, but that's not working yet. And yeah, we also have a leveling system. So every time you use MCS, you could level up. You do your first case, you do 3 cases, and then you level up essentially. We also have missions, active challenges, and yeah. And then you could also see all your cases below here. These are all my cases that I've done in the past couple of days. And yeah. So it's still running. We're trying to make it a little bit faster now. But essentially, yeah. So the agents are all going to talk to each other as specified here. Where is this? So the agents are all going to talk to each other sequentially, and all of their outputs will then be summarized by the final agent here. And then you get a list of potential diagnosis, and you also get a list of treatment options. Our goal is to essentially try and lower the cost of healthcare, because healthcare costs are currently bankrupting many people around the world, especially in America, because America's medical and healthcare industry is completely distorted. And our goal is to solve that problem with agents and swarms of agents that can work together to help you diagnose your condition and also help you treat it as quickly as possible. So alongside our interface, we got our outputs here. Reported symptoms: trouble sleeping, headache symptoms resembling caffeine withdrawal. These are the codes. F1593. Differential diagnosis: insomnia due to anxiety or stress. Sleep study may be considered if it indicates migraine. Diagnosis is primary clinical. Other substance withdrawal to evaluate for primary headaches. So it tells you like who you should consult: neurologist, sleep specialist. Obtain a detailed medical history including caffeine consumption patterns, sleep habits, and any recent changes in lifestyle or stress levels. Conduct a physical examination. Perform a focused neurological examination to assess for signs of neurological defects related to headaches. Follow up. Then we have all the other agents in the pipeline. Recommendations for management: gradually taper caffeine intake to reduce withdrawal symptoms, enhance sleep hygiene, establish a consistent sleep schedule, alleviate headaches, monitor and address vital symptoms, and we get a summary of the entire conversation. So we're going to be adding images as well, so you'll be able to analyze x-rays or CT scans or any type of medical data pretty soon. And as of now, this has been entirely free. We also offer an API so that you can call the MedicalSwarm for free at the moment. So you can, in our documentation page here, you can essentially call the API extremely easily. Just a couple of lines of code, 2-3 lines of code. You can use the API. Just for the swarms, there's no UI here, but yeah, let's see if we can get started with this. Let's see, MCS client test. So this is a test example, and let's run this. So this is our API. Basically how it works, let me just, you import from MCS, import MCS clients. Then you have your case, you have your lab results, history. And then you finally call the API. Essentially, we're trying to automate the medical industry with swarms of agents. MCS is powered by the Swarms framework, and we're actively looking for contributors and team members to help us grow a decentralized marketplace of healthcare agents, so that we can automate the entire healthcare industry and save millions of lives through very cheap, affordable, easily accessible, and secure and accurate healthcare, essentially provided by these agents instead of centralized entities whose sole purpose is to profit off of people and not actually treat them. So if you want to support us, if you want to join us, check out our website at mcs.swarms.world. Join our Discord and start contributing to our GitHub repository, which is here. It's open source. Everything is here. And yeah, contribute and let's save some lives. Thank you for watching, and please like, subscribe, and share this video with friends. Thank you.